and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
Brad,
Bob.
this is kind of a public service announcement. We're going to go over the 5 warning signs that you're about to have a stroke. And then beyond that, we're also going to go, we're going to discuss some of the signs of when you're having a stroke. And then we're going to tell you what to do.
Okay.
Okay,
good.
So we'll go through it. It's pretty comprehensive here.
Right, yeah. This is obviously one of those serious videos that we're not going to joke around too much. Let's go at it, Bob.
Yeah, let's start off. I think one of the most common ones that I see, Brad, in people that it's a sign they're about to have a major stroke is when they have mini strokes or TIAs, transient ischemic attacks.
Right.
And you know, it's funny. My father-in-law, who has since passed away, it wasn't from a stroke, but he had one of these about 20 years ago. And I remember there's a tendency to try to kind of ignore it and act like it wasn't anything.
So he was having a TIA?
He was having a TIA, so he was getting some numbness, he was getting some drooping of the face.
Right.
And they went in, they suspected that's what he had, but they didn't know for sure. And I told him, this is your warning shot. I said, the next time what's going to happen, you're going to have the full-blown stroke.
Right.
And what he went in and found out his cholesterol and his blood pressure, they were all way off.
Sure.
I mean, so
again, that mini stroke or the TIA, you'll get similar symptoms of a stroke, face drooping, one side getting weak, but then they just go away in a short
transient,
time.
I mean, it just lasts a very brief time.
Right, and then you think, oh, well, that's gone, and you kind of
quite often what
is
is happening, the artery is partially plugged, and it spasms and completely clogs for a little bit, and then it opens up again.
Yeah, and then you're back to normal.
Yep. All right, the second thing is if your blood pressure is uncontrolled. I mean, that's just a warning sign right there across the bowel, Brad.
Right. If your blood pressure is real high, you're putting pressure on all those arteries making it more susceptible for a stroke.
All right, the third warning sign, Brad, is if you have a family history of stroke. You're 30% more likely. My grandma had a stroke.
Sure.
None of my parents, fortunately, have not, and I haven't had any aunts or uncles, so I don't think I have a real strong family history, hopefully, but how about on your side? Anybody?
Well, my grandmother did, but she was in her 90s already. She was actually pulled out of it fairly good. My dad has had one stroke, mild one of any full recovery, so yeah, that's making me think about it.
It's in the history. All right, obviously, too, is smoking, Brad. And I know people really want to stop smoking, but I mean, if you want one more reason, this is a good one for it.
Right.
I mean,
it's not only for the heart, but we're talking stroke with the brain health.
Well, just as an example, a woman who smokes and she's between age 15 and 49 has, if she does 2 more packs a day, she's 9 times more likely to have a stroke.
Oh, really?
That's a lot.
Right.
I mean, that's
what if it's a man?
I didn't see that stat. But
I wonder why not.
It was higher in women than men. I'm not sure why, but.
Well, and the other thing I did want to mention, if you're new to watching our videos, we do videos helpful like this. We do exercise videos, how to relieve pain, and all you need to do is subscribe right here, and you can get that. We put a video out every day.
Yep, so don't want to miss out on that. All right, thanks a lot. The number 5 thing that could be a warning sign, actually, Brad, is if you have migraines.
Okay.
And they don't really know why there's a connection to that, but your percentage of the possibility of having a stroke are higher if you have migraines.
This is one of those ones I think don't get too excited. If you're a person that does have migraines or headaches.
No, yeah, there's nothing you can do about it, but you certainly don't want to have the other, I mean, you don't want to smoke if you have migraines, I mean, and increase your risk even more.
Right, if you have migraines and you feel your face drooping or that kind of thing, that's a pretty good red flag.
Right, exactly. And unfortunately, sometimes with migraines that happens.
Okay, yeah that's...
All right, the next thing is, so that's the 5 warning signs, Brad. Now we're going to talk about when you start seeing symptoms, of when you should realize that you are having a stroke. Now, I think one of the national organizations uses the F.A.S.T acronym.
Right, F.A.S.T.
F.A.S.T. So the first thing they look for is if you have something involving your face, and you have some drooping in your face, especially on one side, or if you have difficulty speaking, I suppose that'd be with the face too.
Right, yep, some drooling on one side. It might be one of the extremities. It's usually one side. Both arms are not going to lose coordination on a stroke. It's always one side, and it's always the right arm and the right leg, or the left and the left. It's never the right arm and the left leg.
And that's what the A is for. F.A. That's the arm.
Okay.
So, and yeah, if you put the arm up and you can't hold it up or you get clumsy with it, that's a good sign.
Right.
Something.
If someone's going up to scratch their eye and they cannot find it, and that's a key sign right there. I did want to mention one thing, Bob. I was literally about a year ago, went into the hospital as a clinic actually to get X-rays, and I saw this gentleman sitting there, and his arm was down like this, and I just assumed, well, there's someone who's had a stroke. He's in to see the doctor for a follow-up of the stroke. So I didn't think too much of it. Being a therapist, you just think
Right,
that
you
way.
notice those things, yeah.
And I look back a minute later, and the next thing you know, they're bringing the gurney in. He was literally having a stroke right there. And luckily, he was in a facility where they could get help right away. I hope things worked out for the best for him. But that's an example of
Right.
what
Don't
we're
waste any time.
Exactly.
The S is for speech. That's a common one too, that your speech is involved. I had a friend, Brad, 55 years old, and he just had a stroke. I mean, no reason to have one, and really none of the warning signs, unfortunately.
Right.
And luckily he did go in right away, but he could not speak and he could not think. They asked him his name and he could not think of his name.
Yep.
It's interesting how that.
So if you're not familiar with how strokes work in the brain, they cut the circulation is deprived either through a bleed or through a plug or a clot. But it depends on which part of the brain. I've got a woman right now, her vision was involved, and she still cannot see well. Everything else is working well, but it went to her, it affected her eyes. Sometimes it's speech, sometimes it's global. In other words, the whole side and speech and everything is involved, and that's really unfortunate.
Yeah, we'll go over some more of the other common signs too, Brad, in just a minute. But
Okay.
The last part of the F.A.S.T, F-A-S-T, is time.
Okay.
And in that instance, you really want to make sure that you're calling 911 right away. You don't want to try to drive yourself. I mean, obviously, and even the fact sometimes, I don't know about having someone else drive you.
A friend or family member.
They could go into a panic if you start losing consciousness or.
While you're driving.
Right.
And it's you call 911, get some professionals there.
Yeah, and they can get you to the right, because that's the thing is, you have 3 hours, and you have 180 minutes, and the reason this is so critical now, Brad, they have this drug they can give you, tissue type plasmogenic activator. I had to read that.
That's a tough one.
Yeah. TPA.
Okay.
And this drug can help actually reverse some of the symptoms and the damage done by the stroke. And it's been a miracle when I've seen it work on patients.
Sure.
Brad. I mean,
but you got to get them in that 3 hour window so that they can, administer the drug.
And it has to be a hospital that has this.
Okay.
Because some hospitals don't.
Okay.
Or some clinics don't, I would say. So that's another reason to call 911 sometimes, because they're going to know which clinics or hospitals have this. So, well, let's talk about some of the other symptoms, Brad, that you could have with a stroke. One is loss of balance. They might just suddenly try to get up and they're going to lose their balance. One, because of weakness, but sometimes the balance center is affected with a stroke. So
just sitting in a chair, you may. If someone is sitting there and they're always sitting upright, and you notice them leaning like this for some unknown reason, it's like, why are you leaning this way? And they're probably not even aware that they're leaning that way. And if
right, because that's off.
Right. Because it's interesting when you work with someone who's had a stroke and they're leaning or they're standing, they feel like they're upright, but indeed they're off.
Well, we have what is called pushers, Brad, where if they're sitting there and you try to, if you sit right here, Brad.
Yep, this is, all therapists know about this.
And you try to straighten them out, they actually push against you harder even.
Because they think you're tipping them over.
Yeah, they think you're going to push them over the other way. So it's just weird how their proprioception and body, space is just all screwed up. They don't know where they are in space.
Screwed up. So, that's a pretty good technical term.
Yeah.
Okay.
I think we talked about this a little bit. A lack of understanding. They may not know what you're even saying, or they can't process it. Obviously, another one. This is a very common one, Brad. Is a really severe headache.
Yeah.
I mean, and especially when you're not normally getting headaches.
Sure.
And suddenly you get someone that's a real severe. That's a common one. Trouble swallowing. I mean, if if you try to give them water, not only the drooling, but they actually can aspirate it, go into the lungs.
Right.
So it's not something you want to do. Dizziness, And did we talk about numbness, lack of sensation?
No, we didn't mention it, but that's very common.
So you can see there's really a wide range of symptoms that can show up. And whenever something pops out of the normal like that, that's when you want to get them in and get things checked out. Better to go in and be wrong than to miss out on that 3-hour opportunity.
Exactly. So very good, and we hope we never have to deal with this.
Yeah, thanks for watching.